for joining us for the International Student Connect webinar on disorders that may affect mental wellness. So today we're going to talk a little bit about the different disorders that could affect a person's mental wellness. Before I do that, I want to talk a little bit about our organization and the role that we play as project coordinators. My name is Ingrid, and we are the coordinating agency. Costi Immigrant Services is the coordinating agency for the International Student Connect project. We have 17 locations across the Greater Toronto area, and we service about 39,000 clients annually through those 17 locations. The International Student Connect project was designed to provide support to international students and their families. The project is funded by the Government of Ontario, and we are the agency that coordinates the services between the colleges, universities, and the settlement agencies that brings this project to you. Within the project, we have uh, various institutions and settlement agencies that will provide you with support. So on today's agenda, we're going to look at mental health disorders, the four major disorders, anxiety, eating disorder, depression, and bipolar disorder, as well as schizophrenia. We'll look at some substance abuse disorders and some ISC resources that we have for you. And as I mentioned earlier, our project is funded by the Government of Ontario, and we are the coordinating agency. So let's just get right into it. Mental health disorders compromises of a broad range of problems. So with different symptoms, however, they are generally characterized by some combination of abnormal thoughts, emotions, behavior, and relationship with others. And this is from the World Health Organization that we've gotten this definition from. Now, examples of these could be schizophrenia, depression, intellectual disabilities, and disorders due to drug abuse. Most of these disorders can actually be successfully treated, which is what a lot of people don't really recognize, that a lot of these disorders actually have treatment that works. So, studies conducted by WHO, the World Health Organization, indicates that there are several factors that can affect a person's mental health and contribute to mental disorders. These factors includes, but are not only attributed to the person's ability to manage one's thoughts, emotions, behaviors, and interactions, but also social, cultural, economic, and environmental factors also plays a role into that, such as national policies and social protection, standards of living and working conditions, etc. Now, 70% of mental health problems have their onset during childhood or adolescence. And we're getting this information from the Canadian Association of Mental Health here in Canada. Um, Young people aged between the ages of 15 to 24 are more likely to experience mental illnesses and sometimes substance abuse or substance use disorder than any other age group. In Canada, 34% of Ontario high school students indicate a moderate to serious level of psychological distress, symptoms of anxiety and depression. And then there's 14% indicates a serious level of psychological distress. We also found that men have higher rates of addiction than women, while women have higher rates of mood and anxiety disorders. Um, Mental and physical health are linked. So, people with long term medical conditions, such as chronic pain, are more or much more likely to experience mood disorders, and conversely, people with mood disorders are at a much higher risk of developing long-term medical conditions. So you can see the correlation between the different factors, that the different things that factor into those who are at risk for mental health. Um, you know, a lot of times I feel like people do not necessarily understand mental health challenges, and they don't really understand mental illnesses. But we wanted to break this down for you. So mental illnesses can take many forms, just to give you a clearer perspective, just as physical illnesses do. Mental illnesses are still feared and misunderstood by many people, but the fear will disappear as people learn more about them. So if you are someone you know has a mental illness, there's good news. Yeah, all mental illnesses can be treated. And I mean, all of them do have treatment. So we're going to talk a little bit about, the mental illnesses that can be treated by um, that are called psychiatric disorders and the treatments for those, and just kind of give you a deeper understanding of how mental illnesses are treated. So, there are several types of mental health disorders. In the interest of time, I'm just going to focus on five. These five that we're talking about are not the only ones that are available, but we're going to be talking about these, right? Um, Anxiety disorder, depression and bipolar disorder, eating and obsessive compulsive disorders, as well as schizophrenia. If you need additional information, you can go to www.cmha.ca and you'll find a little bit more information on those disorders. And it's broken down very simply and very easy for you to understand. We all feel nervous or worried at times, and this anxiety can be helpful in terms of, it will motivate you to do better. Anxiety also warns us of danger. An anxiety disorder, on the other hand, however, causes unexpected or unhelpful anxiety that seriously impacts someone's life, including how we think, how we feel, how we act. And there are several mood disorders that their anxiety as well, right? So phobias. Let's look at phobias, for example. A phobia is an intense fear around a subject, a specific thing, like an object, an animal, or a situation. For me, I am petrified of lizards, and I grew up in the Caribbean. So if you think about it, growing up in the Caribbean, I should not be afraid of lizards and frogs and things like that. But anything buggy, I am petrified of it. So most of us are scared of something. Um, you know, Feelings, but look, it doesn't mean that because I'm afraid of it, doesn't mean that, you know, something is so grotesquely wrong with me. With phobias, people change the way they live in order to avoid the feared object or situation. And then there's panic disorder. Panic disorders involves repeated and unexpected panic attacks. A panic attack is actually a feeling of sudden and intense fear that lasts for a short period of time. I've had those too. It used to get so bad that I would carry a brown paper bag with me so that when I started to hyperventilate, I'd be able to hyperventilate in that bag and kind of um, level my breathing, bring my breathing back. And I used to have those when I was like maybe from the time I was like 15 to about 22 years old. I suffered from panic disorders. It causes a lot of physical, like, your heart is racing, there's shortness of breath, you feel nauseated, and you get these panic attacks to normal reactions. It can just be quite normal to something that is part of a disorder. So, there is agoraphobia. Agoraphobia is fear of being in a situation where a person can escape or find help if they experience a panic attack or other feelings of anxiety. Most people with agoraphobia may avoid public places or even avoid leaving their homes at all. And then there's social anxiety disorder. Social anxiety disorder involves intense fear of being embarrassed or evaluated negatively by others. As a result, people often avoid social situations. This is more than shyness. It can have a big impact on work or social performance relationships. Um, and so there's several different types of disorders. Who do they affect? Anxiety disorders can affect anyone at any age, and they are the most common mental health um, problems that people will face. Sometimes anxiety disorders are triggered by a specific event or a stressful life experience. And anxiety disorders may be more likely to occur when we have certain ways of looking at things, like believing that everything must be perfect. And I think that that's where mine came from, because I used to be a perfectionist. I wanted to make sure that everything was just right. And if it wasn't just right, then I'd start having a panic attack. It would just be like, I got to fix it. I need to fix it. I need to fix it. And then the attack would follow that kind of thought process. So, what can be done about it? Talk to a doctor, identify how it affects you, and you can get treatment like counseling, medication, support groups, and different self help strategies that you can use to help yourself as well. And we'll talk about those in a little bit. Now, there are eating disorders, and there are different types of eating disorders. For example, there's anorexia nervosa, bulimia, binge eating disorder, and these are all, they're related to people's weight. They're all consuming, when people have these all consuming preoccupation with calorie, grams of fat, and exercise and weight, that allows them to displace the painful emotions of situations that are at the heart of the problem. So, most people that will have these disorders, it is coming from somewhere. The disorder did not just manifest. There are usually underlying problems that will then develop into these kinds of disorders like anorexia. A person may refuse to keep their weight at a normal body weight. They may do so by restricting the amount of food they eat, or they'll exercise so much more than the average person, and they may feel overweight regardless of their actual weight. When they look in the mirror, they'll say, well, but I am so fat, when realistically, they're not fat. Or they're not overweight, but they will say these things. They'll say, I'm overweight, I need to lose more weight. This is because there's something else that is causing these issues. This illness can cause heart and kidney problems, low blood iron, bone loss, digestive problems, and a multitude of other problems. As many as 10% of people who experience anorexia die as a result of health problems, or some people um, will, you know, become suicidal. um, Bulimia nervosa it includes periods of uncomfortable binge eating followed by purging. So the person will eat a lot. Let's say they eat a lot of things, and then they'll go and self-purge. So they'll go to the bathroom and um, try to force themselves to throw up, or they'll use laxatives to get rid of that food out of their system. People who experience bulimia nervosa may feel overweight regardless of their actual weight. And these illnesses, just like anorexia, will also cause kidney problems and dehydration, digestive problems, things like that. Damages your teeth, and um, your dental health could be affected, as well as your throat. Binge eating disorder. The binge eating disorder involves periods of overeating, where people will overeat and feel distressed or depressed or guilty after binge eating. Many people try to keep eating a secret. Sometimes they'll develop this problem after dieting. Some people may fast, not eat for a period of time, or diet after periods of binge eating. And this disorder will increase the risk of type 2 diabetes and high blood pressure as well. So you can see that there are some serious issues with this. Who does this illness affect? It affects just about anyone. It could affect anybody. Um, there are people who are at higher risk. So, people who experience low self esteem or poor body image, perfectionism, or difficulties dealing with stress may be more likely to experience an eating disorder. A lack of positive social supports and other important connections may also play a huge role. In some cases, eating disorders can go along with other mental illnesses. So I'm asking that if you're not someone who struggles with an eating disorder and you see someone who's struggling with it, don't feel like, this is something that should be taken lightly, or that, you should ridicule this person or think it's funny that they're going through these things. These are truly illnesses that people struggle with and cannot truly find a balance to help themselves be better. So, what can be done? You may have a lot of difficult feelings. So, people may have a lot of difficult feelings around finding help. It isn't always an easy step to go in and say, I need help with this. I think that I'm suffering from an eating disorder. Most times, people will not divulge that. So, if you are having this issue yourself, I'm telling you that, you can talk to a doctor, talk to friends about it, open up about it. It's, for me, that was the easiest and the best way to get through a lot of the issues that I faced when it came to any mental health challenge that I was having. And there are different treatment options. While there's no medication specifically for eating disorders, you can talk to your doctor, a support group, and you can also talk to a counselor one on one about this as well. There is the schizophrenia disorder. Schizophrenia is a mental illness that affects the way you understand and interact with the world around you. Things around you may feel different, look strange, may have concentration and communication issues, and some people will experience breaks in reality. Every one experiences these illnesses differently. So some people may even believe that they have superpowers. And these are, the different types of schizophrenia, symptoms of schizophrenia. After an episode, signs can continue for some time. People may feel restless, they may withdraw from others, or have a hard time concentrating. Who does schizophrenia affect? It can affect anyone, and it often begins in the teen years. Uh, you know, Research shows that females often start to experience the illness a little bit later than males. No one knows exactly what causes schizophrenia or why it can affect people so differently, because it does. I may be. I may suffer from schizophrenia, but I may have different symptoms from the other person who does. Genes, the way a person's brain develops, and life events may all play a role in how the disease and the illness affects you. What can we do about it? Well, you can talk to a doctor. You can also identify the signs of your triggers, and there are treatment options. There is medication, there's counseling and support. And if you're not experiencing that and you've got family members who are, I implore you to give them support. Love on them like a lot, be kind to them. When they're going through an episode, try to understand that this is not your family member. This is actually the illness that is coming forward and causing them to react the way that they are reacting. And that can make life a lot easier for them. Now, depression and bipolar disorders are mental illnesses that affect a person's mood, the way a person feels. Now, you know, this is very hard to describe. Like, I suffered from depression and struggle with it from time to time, and it's quite difficult to kind of explain how you feel. You just know that your mood changes. Sometimes you're really sad, and sometimes, you just feel really lonely, and like the world doesn't have anything to offer you. But these are all feelings that can be helped, like feelings of sadness, worthlessness, hopelessness, and anxious, irritable, and angry. People get like that when they struggle with these different types of disorders. Now, those are the symptoms of depression. And bipolarism, there are episodes of depression and mania. So when we talk about mania, the person gets manic with the bipolar depression. People experience episodes of depression, and they also feel like they're going to lose their mind as well. Um, it is quite difficult sometimes for the distinction to be made. People may feel like their thoughts are racing, they may feel hyperactive, they may feel unrealistically confident, happy, or powerful. And many people who have this illness, they don't sleep much when they experience the manic episodes. People usually experience periods of wellness between episodes of depression or mania, and the episodes of depression or mania generally last for a period of time, though a small number of people may experience these episodic issues and they change very quickly. Who is affected by either of these? Um, it can affect anyone, often begins in the teen, just like schizophrenia, and you need to talk to your doctor, recognize that you're relapsing, and seek help immediately. There are medications that can treat it, counseling and support. And again, I implore you to give love and comfort to your loved ones who are experiencing these episodes. If you're in crisis, find help. This is a list of all the support that you can get. You can go to the Canadian Mental Health Association, Crisis Services Canada, and Kids Help Phone for some support. And then we look at the substance abuse disorder. And the substance abuse disorder can be really challenging to identify. Substance abuse disorder includes alcohol abuse, dependence on prescription medications such as opioids, painkillers, or antidepressant drugs, cannabis use. Cannabis abuse. We know that cannabis is now legal in Canada to use, but it can be abused as well, regardless of the fact that it is legal. People who are at the highest risk are those who are between the ages of 15 and 24, those who experience stigma, and the highest rate of substance abuse is in males, or they have a dependence on substance abuse. And we found a study that shows that substance abuse disorders over the 12-month period of the study. Approximately 6.4% of males and 2.5% of females reported symptoms consistent with substance abuse disorder. That is approximately 4.7% of males. So, it's crazy the numbers that we look at. We think that it's only for some people, but any one of us could fall into that category given the right circumstances or the wrong circumstances. So if you know someone who has any of the following behaviors, for example, failing health, missing school or work, feelings of isolation, changes in behavior, these are some symptoms of substance abuse disorders. And there are different treatments. So for example, there's day treatment, group therapy, case management, and residential or inpatient treatment. Find help if you need help for this issue. You can definitely contact the helplines that we've provided here. There's Ontario Drug and Alcohol Helpline, Canada Drug Rehab Addiction Services Directory, and the LifeRing Alcohol and Drug uh, peer support. Those are really good ones. We've got also Kids Helpline, Mental Health Helpline, Young People Good to Talk, and eMentalHealth.ca. Now, if you need additional support, please contact us. I'm going to leave our contact information if you find that you need us to send you perhaps the slides, or if you need us to send you some additional resources that you can find help. The International Student Connect project also have some resources that you can use for yourself. We have a transition plan on our website. It's www.internationalstudentconnect.org. Visit our website and look up the transition plan, especially if you're planning to remain in Canada after you graduate. This will truly help you to keep track of the things that you need to do. If you want to contact us, you can call us at 1-844-871-4567, or you can email us at isc@costi.org, and we'll be so happy to assist you. I'd like to thank you for joining us for today's webinar, and I'd like to see you in our upcoming webinars. You can register again at www.internationalstudentconnect.org. That's our website. And we've got many, many webinars upcoming. Some of them are live and some of them are on demand. Well, most of them are on demand, so you can absolutely access them at any given time. Thank you so much. And I say go out, have fun, enjoy the rest of your day because life is beautiful. I'll talk to you soon.